I am Dr. Lokesh, HM, gastrosurgeon and a laparoscopic surgeon at Narayana Hospital, Mysore. Today we will talk about hernia and its surgery. Hernia is one of the common symptom or the presentation in our outpatient department. Many patients comes with different types of hernias. There are varieties of hernias like inguinal hernia, which is present in the groin, umbilical hernia, which is present in the umbilicus, and an epigastric hernia which is present above the umbilicus, means the between the xiphi and the umbilicus. So, and there might be an hernia at the point of where the previous surgery has been done, that is called as incisional hernia. These are the common types of hernias which we usually see in the day-to-day practice. Hernia means there is a hole in the abdominal wall, means the muscle wall. So that layer will have a hole through which the contents of the intestine will come out and forms a bulge, and it might go inside when you lie down. So that's the common symptom usually which we get in any hernia, like whether it's an umbilical hernia or inguinal hernia or epigastric or an incisional hernia. Majority of the times they come out when you cough or sneeze, and it might go down or go inside when you lie down flat, or you might when you give little pressure, so it will go inside, so that the swelling or a bulge will go off. So this is the common presentation usually all patients will have. So these patients might have complications like, so the contents which comes out might be stuck there and might not go inside, so that will cause a pain, or if some intestine comes out and stuck inside, that might cause an obstruction in the intestine. So that time patient might have vomiting and abdominal distension. So that's a complication. Or when the intestine gets stuck and its blood supply is also compromised and no blood supply to the intestine which is stuck, so then that causes an gangrene, that called as strangulated hernia. So this might be this kind of complication might be there in all kinds of hernias. It's not specific to any one hernia. So all patients of hernia will have these kind of complications. So to avoid these kind of complications, treatment is necessary. As I have told, so surgery is the only treatment which is available for hernia. So how we will do the surgery for hernia? The surgery will be done as the contents which are coming out will be placed back into the abdomen, the hole will be closed and the mesh will be placed. This is the basic principle of surgery. So how this surgery is performed? It can be performed laparoscopically or an open method. In open method, we place a big incision and then reduce the contents and close the hole and then place a mesh. And in laparoscopic method, we place the trocars inside and we go into the abdomen, inflate the abdomen, reduce the contents, close the hole and then place a mesh. So this is both the time the principles of surgery are same. So after the surgery, the pain and the infection rates and the comfort will be far better with the laparoscopic method as compared to open method. Open surgery patients will have a bigger wound, chances of infections are high and the pain is more, the recovery will be slow and getting back to their work will be delayed. In the laparoscopic method, the advantage is the pain is less, wound is less, and they can get back to their routine early and the infection chances are very less. Both in open and in laparoscopic method, we place mesh. So there is a misconception that in laparoscopic method we can't place a mesh, but no, we can place a mesh and we usually place in all the patients. So this is the advantage of laparoscopic surgery for hernia.